Neurosurgery at UCSF believes the odds are better.
The overall goal here is to try and give a substance to a patient to illuminate a tumor so that we can take it out in a more aggressive fashion.
The tumor itself is clearly visible on the operating room monitors, but in a moment, Dr. Berger is going to get an entirely different view of it.
Can you turn the light on?
The blue light shining down from the microscope is part of an experimental technology. Several hours before this operation, the patient was given an oral dose of an organic dye known as 5-ALA. The substance migrates into tumor cells, causing a biological reaction that turns them fluorescent, making them clearly visible under laser light.
So this is a glowing tumor now. The dye is being excited and it's turning the tumor orange.
Using the microscope to guide him, Dr. Berger's instruments zero in on the orange areas visible on the screen. First, he'll remove the tumor itself.
This is like flying a plane with radar at night.
But he says the real advantage will come next when he begins hunting for cancer that often remains hidden.
Because a lot of the times the tumor is very clear, but the actual infiltrating margin looks just like normal brain. So it's hard to find those cells. But now that they're orange, we can just go after them selectively.
For the next hour, Dr. Berger methodically clears out the tiny spots of orange, eliminating cells that could cause the tumor to return.
So not only have we taken out the tumor, but we've taken out any of the small cells.
The fluorescence-guided glioma surgery is new in the U.S. Dr. Berger's team is leading a clinical trial right now, but there are results from a study in Europe showing long-term benefits for patients. In that study, published in the journal Lancet, a German research team found that surgeons were nearly twice as successful at removing the entire tumor using the fluorescent technique. And after 6 months, those patients were twice as likely to have no recurrence.
All of this is pretty bland.
With all the visual evidence of cancer cleared away, the patient is now ready for postoperative cancer treatments, which Dr. Berger's team believes will have a higher chance of success.
Well, absolutely. This told us that we not only took out the tumor, but we took out the invading, infiltrating tumor margin, which is really going to make a huge impact for him in terms of his outcome.